Hi, my name is Sydney Phillips, and this is Brigham Young University's Assignment 5, which is the informative speech assignment. Today I'm going to be sharing with you information on a topic that I'm very interested in, and that is schizophrenia. I know many of my listeners have heard about schizophrenia but may not know exactly what it is, so today I hope to teach my audience what exactly schizophrenia is, the effects of it, what causes those effects, and how to treat it. My purpose in sharing about this subject is to educate my audience on one type of mental illness that I find particularly interesting and that many people don't really know about, and that affects many people in the U.S. So I'm just going to start with a scenario, and that is imagine waking up each morning, taking a shower, eating breakfast, trying to engage in normal everyday activities just to hear voices inside your head telling you that you are not good enough and telling you to hurt yourself. These voices are mean-natured. They scream things at you. They tell you to hurt yourself. They put you down, tell you to do things that you would not normally do. These voices do it so often that you begin to lose all control of yourself and allow these voices to dictate and influence your every movement and your every thought. You become so paranoid and start thinking that the people around you are starting to hurt you. You become so tired of the pain that you are experiencing that you listen to these voices. And you start believing that what they say is actually true. You start to hurt yourself, taking drugs and drinking alcohol just to ease that pain. This is a scenario and is an example of what many people with schizophrenia have to deal with and hear on an everyday basis. So I am now going to teach my audience what exactly schizophrenia is, the effects of it, and what causes those effects, and how exactly it is treated. I'm currently entering my senior year of college, and I'm in nursing school. And last semester, as part of our core work, our nursing core, we take behavioral health, and which many people call psych. And as part of that curriculum, we go to a psychiatric facility every Friday, every other Friday, and we spend many hours there and just kind of learn about all the different mental disorders, and we get to see and interact with people with many of those mental disorders. And so I became kind of fascinated by mental health, and now I currently work at a behavioral health hospital as a patient care assistant. Mental health will affect everybody, if it hasn't already, at some point in their life, whether it be a personal connection that they have, someone they know has it, or they watch a television show or a movie, or see on the news a story about somebody with mental illness that ends up affecting them. I just want to inform my audience about one specific type of mental illness that is very interesting to me that many people don't know much about. And as I previously stated, I'm going to be speaking to you about what schizophrenia is, the effects of it, what causes those effects, and how exactly it is treated. So many of you may not know this, but schizophrenia is a dilapidating chronic brain disorder that affects a person's ability to function normally, and it usually presents between the ages of 15 to 25, and it's mostly in men. There's little known about the exact cause of schizophrenia. However, research has shown that there are many risk factors that are associated with the development of it. Instead of there being one simple reason why schizophrenia develops, schizophrenia is more clearly defined by its symptoms and the criteria for the diagnosis of it. And it's just a lot of behavioral changes that is seen with it. So those symptoms that are individual to schizophrenia, like psychosis, for example, help its diagnosis by the DSM-5, which I'm going to talk to you a little bit more about in a little bit. So according to Margaret Jordan Halter and Edward A. Heroes in the textbook called Foundations in Psychiatric Mental Health Nursing, the many different risk factors for schizophrenia, for the development of schizophrenia, include genetics, neurobiology, brain structure abnormalities, psychological and environmental factors and stressors, and prenatal stressors. And it has been proven that schizophrenia, in fact, is 80% of it is genetic. So there's a 20% that people have gotten it without having like a family member that has gotten it, but 80% of it is actually, in fact, genetic. And in addition to a genetic risk factor. Drugs is a big risk factor, like amphetamines, cocaine, even marijuana in people, and it will show in people that have taken those drugs and that were already more vulnerable. Brain structure changes can also cause schizophrenia by blocking communication in the brain between the neurons. So that's a risk factor. So just to kind of give you a visual of what exactly this looks like, here's an image, and here's the healthy brain and a brain with schizophrenia. And so this image I actually got from WebMD. But so there are many structural changes in the brain that occur with schizophrenia. And so PETs and MRIs, like that, they're imaging tools that can show a picture just like this one right here. And it can show just how much there is a structural difference between someone who's healthy and someone with schizophrenia. A structural change is that there's gray matter in your brain, and as you develop schizophrenia, the gray matter decreases, and the gray matter is the part of the brain that contains the nerve cells. So this is not the perfect picture to show gray matter, but I just wanted to show how there's an obvious difference in a healthy person's brain and someone with schizophrenia. So you can just kind of see here that there's an obvious structural difference. So in addition, there are other factors that can cause schizophrenia, like high stress situations. So that can include inflammation, illness, anything that causes stress, and cortisol has a direct effect in it. So when you are stressed, your cortisol increases, and that can lead to schizophrenia. So in situations where your cortisol could be increased is when there's been sexual abuse, you live in a lower socioeconomic status, you live in a place where there's high crime, or you've had exposure to trauma, that can increase cortisol, which in addition increases the inflammation in your brain, causing your gray matter to decrease. So in addition to its risk factors, the diagnosis and the criteria for the diagnosis helps define schizophrenia. And there's so you're diagnosed via the DSM-5, and it's just a universal book of all the mental illnesses that there are. And I'm just going to read to you a couple statements of criteria for their diagnosis because it's very long. So me reading it would take all of it would take way too long. But a patient to be diagnosed with schizophrenia, a person must have one or more of the following present for a significant amount of time during a 1-month period. And these symptoms include delusions, hallucinations, disorganized speech, grossly disorganized catatonic behavior, and negative symptoms. And I'm going to go over each of those things a little bit more in the next section. But they also can have continuous signs of disturbance that persist for 6 months long. And then also this disturbance is not attributed to the physiological effects of substance abuse. So those are just 3 of the many criteria for diagnosis. So the effects of schizophrenia, we've already been over what causes it. Now I just want to talk to you about the effects of it. So people with schizophrenia disorder display a combination of symptoms called positive, negative, and cognitive symptoms. And so positive symptoms are symptoms that are not normally present in a healthy person, and that can include delusions, hallucinations, thought disorders, and catatonic movement, so movement that's just everywhere. Not confined, but everywhere. An example of a positive symptom is, like I said, a hallucination, and that could be visual or auditory, so it could be someone telling the person, or a voice telling the person to hurt themselves or hurt others around them. Negative symptoms are associated with an absence of or a disruption in normal emotions and behaviors that someone typically has. So negative symptoms can be a flattened affect, so they don't really have much facial expression. They have a decrease in amount of speech. They have reduced feelings of pleasure that is experienced in everyday life that they used to be able to experience. So this can be seen in someone who is very monotone or has a lack of emotion. The next and the last is cognitive symptoms, and this can be subtle or really, really obvious changes in a patient's memory or a thought process. So this can be an impairment in memory, attention, judgment, or problem solving. An example of this could be a patient just simply forgetting how to brush their teeth, and they could be an adult and just have completely forgot how to brush their teeth. So how it is treated, patients with schizophrenia can be treated with medication, or in addition to medication, they can be treated with therapy, and usually you see both of those. So medications that are typically used for people with schizophrenia are first generation and second generation antipsychotics. And these medications, these antipsychotic medications usually take 2 to 6 weeks before you see desired effects. And this can sometimes be a problem because we will have a problem with medication compliance, because as those desired effects, as you're waiting for those desirable effects, you can experience side effects of those drugs, including dry mouth, urinary retention, constipation, blurred vision, dry eyes. And so people, for that sometimes 2 to 6 week period of waiting for the medication to work, people just get fed up with the medication and just decide to stop it cold turkey. And stopping those kinds of medications cold turkey leads to a wide variety of problems that can occur. So in addition, however, the problems with those medications, I've seen those medications work absolute wonders with people with schizophrenia. And so it's just important to keep those patients, keep telling them it's going to be fine. Just, you need to wait that 2 to 6 week period. And so in addition to medication, we also use therapy, and that can include family therapy. And you want to introduce the family into the therapy because many family members can become isolated from their peers, communities, and their support systems when they have to deal with schizophrenia in the family. So as you've now learned, there are many factors that categorize and characterize schizophrenia, like its causes, effects, and how to treat it. And as I've said, schizophrenia is defined as a complex disorder that involves symptoms and behaviors that alter normal activity and relationships in daily life. So just to kind of wrap this up, I just want to show you an image of just kind of showing you all the different factors that play into schizophrenia. So here's just a visual of all that. They have disorganized thought, they have hallucinations, it can have to do with their genes, they can have delusions, they're usually socially excluded. And so this is just shows how complex this disorder is. So as I said before, mental health will, if it has not already, affect each person throughout their life. Like I said, whether it be a personal connection to it or something that they've seen. And I hope today that my audience has become more familiar with schizophrenia and is more knowledgeable about it and has enjoyed learning about it and find it as interesting as I find it. Thank you.